you've got to present yourself as a safe radiologist. That is absolutely crucial. Okay. And to present yourself as a safe radiologist, let me just go through what is the criteria for passing this exam. First of all, we cover the fail. When people get a 4, and remember the scoring is between 4 and 8, the reason is that they've missed their key findings, they've got a wrong or dangerous diagnosis. They may even get what we call a bare fail, which is because they're slow to spot the abnormality, or they give poor differentials and they needed the help. They needed the examiner to prompt them. A 6 is where they see the abnormalities. They needed a little bit of help, but not a lot of help. They got the principal diagnosis correct and they gave a differential. But if you do anything more than that, like you quickly pick up your sort of succinct presentation, you get your correct diagnosis, you make the correct deductions, you've offered a good differential, you'll get a 7, and an 8 is where there are absolutely no errors. Okay. Now, in the in the exam, every modality counts because it's not a case that they mark you in necessarily. If you have a chest X-ray and a CT, they might mark you on the chest and the CT separately. So each of them will get 4 to 8 marks, 4, 5, 6, 7, 8, one of them. And then they will, at the end of the exam, they will add it all up together. They will divide it by the number of cases, which is what results in your final score. And I think one of the reasons that people fail the Vivas is because they don't reset. That means that after they get a difficult case, they keep dwelling, they get nervous, they keep dwelling on that case. Every case is an opportunity to redeem yourself if you're doing badly, and an opportunity for you to shine. Okay, if so, you've got to reset your mindset, and you've got to report every modality with enough detail for them to give you a score. This is a typical Viva score, this marking sheet. This is the one we use for our Southwest FRCR course. So the examiner would have written the diagnosis, they're given the modalities, they'll give the main points, and then they'll give this sheet to their co-examiner. And the co-examiner will be marking you on observation, interpretation, deduction, clinical, the use of clinical information, clinical management, and whether you're safe. And safety trumps everything. So if you're not safe, so for example, this might be a typical example of a marking in a set of cases. This candidate, he got 555, 65, he got 5.2, 5.8 in the other case, 6.56, 6.83, but he passed overall, even though he failed 2 cases. So he clearly managed, he or she clearly managed to redeem themselves and do well at the end. Now, examiners, um, they want a good pass or a good fail. Or a bad fail. It's really hard for them if you're a borderline candidate. So make sure that you give them a good pass. The key to success is to focus on goals and not look at your obstacles. So now you've got, let's say in June, we've got about 2.5 months to really crack this. You've got the whole of April, the whole of May, and a bit more to crack these exams. Think of what you need to do to pass. You've spent a lot of money trying to sit this exam. You might as well make it count. I strongly recommend you do not sit an exam unless you're ready. Exam spaces come up all the time. That means that people drop off at the last minute and an exam space will come up. You may not have been preparing for the exam and you may be tempted to just give it a go, try. Not only does a fail affect your morale, it also takes off one of the chances you have to pass. And and the loss of morale is huge, okay? I don't recommend you take the advice that people have said saying I passed in 1 month. I don't believe it. I absolutely don't believe you can pass this exam in 1 or 2 months of practice. UK candidates don't do it. Such people have been practicing for a long time. They just did a little, they increased the intensity a little bit. So don't believe anyone who says you can pass this exam in a few months. Unless you're extremely good and you've been, doing this, you've just finished your residency or something. I would suggest you need at least 3 to 6 months to pass. Okay. Um, you can do it in 2 months, but you'll have to give up your job and really put in the practice. Your goals is to try to make the examiner's job as easy. Show competence, safe practice. Do not waste your time on the hot seat. Try to see as many cases as possible during the Viva to get a better score.